Welcome to The Explainer. Today, we're going to break down a really important piece of the healthcare puzzle, Medigap. Look, if you're on Medicare or you're getting close, this is something you absolutely need to understand. So, let's just dive right in. Okay, let me start with a question for you. You've got Medicare, so you probably think you're all set, right? Fully covered? Well, what if I told you your plan has gaps? For millions of people, that's exactly the case. You know, a good way to think about original Medicare, we're talking parts A and B here, is like it's the foundation of a house. It's solid, it's essential, you can't build without it. But it's just the foundation. It isn't the whole house. And it has some pretty significant gaps that can leave you totally exposed to some big costs you just didn't see coming.
So what exactly are these gaps? Let's pull back the curtain and take a really close look at what original Medicare doesn't cover. It pretty much boils down to three main things. You've got your deductibles. That's the chunk of money you have to pay first, before Medicare even starts to help. Then there are copayments, those fixed amounts you pay for a doctor's visit or a service. And finally, there's coinsurance, which is your share of the bill, usually a percentage. Now, one of these might not seem like a big deal, but trust me, if you have a serious health issue, these things can add up, and I mean frighteningly fast.
All right, so now we see the problem, right? These unpredictable and potentially huge costs. So what's the solution? Well, this is where Medigap steps onto the scene. Think of it as your financial safety net. So what exactly is Medigap? It's insurance you buy from a private company, and you'll sometimes hear it called Medicare supplement insurance. Now, the most important thing to get here is that it doesn't replace your Medicare. It works with it. It's specifically designed to plug those holes, to fill in the gaps, and pay for the costs that would normally land right in your lap. A Medigap has some features that are just fantastic for consumers. First off, the plans are standardized by the federal government. This is huge. It means a Plan G from one company has the exact same core benefits as a Plan G from any other company. The only thing that changes is the price. You also get incredible freedom. You can see any doctor, anywhere in the country, as long as they accept Medicare. No networks to worry about. And your policy is guaranteed renewable. They can't drop you as long as you pay your premium. But there is a catch you gotta know about. Policies are for individuals. So if you're married, both you and your spouse will need your own separate plans.
Medigap has actually been around ever since Medicare started, way back in 1966. But in the early days, it was kind of the Wild West. The plans were confusing, they weren't consistent, it was a mess. That all changed in the 90s with what I like to call the big cleanup when federal laws came in and standardized everything. A couple of other big changes happened more recently. In 2020, two of the most popular plans, C and F, were phased out for new folks. The idea was to make sure everyone has a little skin in the game by paying their own Part B deductible. And all that history is exactly why the plans look the way they do now.
Okay, I need you to lean in and pay close attention here, because this is probably the most important, most time-sensitive part of this whole thing. When it comes to signing up for Medigap, timing is literally everything. I want you to burn this number into your brain. 6. 6 months. That's it. This is your one-time Medigap open enrollment period. It starts the very first month you turn 65 times and you're signed up for Medicare Part B. This is your golden ticket. Do not miss it.
So why is this 6-month window so unbelievably critical? Because when you're inside that window, you have guaranteed acceptance. An insurance company cannot ask you a single health question, they can't charge you more because you have a pre-existing condition, and they absolutely cannot deny you coverage. It's the law. But the second you step outside that window, whoa, it's a completely different ballgame. You'll almost certainly have to go through medical underwriting, which means they can dig into your health history, charge you way more, or just flat out deny you a policy.
Okay, so Medigap sounds pretty great, right? But it's not the perfect fit for everyone. It definitely comes with some serious trade-offs. So let's be fair about it and weigh the pros against the cons.
On the pro side, the benefits are huge. You get this incredible peace of mind because your costs are predictable. You get total freedom to see any doctor you want, and you got a rock-solid shield against catastrophic medical bills. But the cons, they're real too. First, there's the price tag. You have to pay a monthly premium for this, on top of your Part B premium. Second, the benefits are pretty bare bones. We're not talking dental, vision, or hearing coverage here. And lastly, there's what I call the one-way street. It can be really hard to switch from a Medicare Advantage plan back to a Medigap plan later on, especially if you've developed health problems. So, where is all this heading? I mean, to make a good decision that's going to last, you have to look down the road a bit. So, let's take a peek at what's on the horizon for Medigap.
All right, the biggest trend, and I hate to be the bearer of bad news, is rising costs. It's no secret healthcare is getting more expensive, and because of that, premiums for the most popular plans, G and N, are expected to jump somewhere between 10 and 13% in 2025 alone. That's a serious hike, and it's something you have to bake into your long-term budget.
There are a few other key trends to keep on your radar. Now that Plan F is off the table for new enrollees, Plan G has really become the dominant choice, the go-to plan. On the bright side, we're seeing more states adopt birthday rules, which give you a special window each year to switch Medigap plans without having to answer health questions, which is great. And finally, just like everywhere else, expect to see more tech. Things like AI and digital tools are coming that should make managing your policy a whole lot easier.
So, after all of that, what does this all boil down to? What's the fundamental choice here? It's actually pretty simple. Medigap is a trade. You are trading a predictable, fixed monthly premium for powerful, rock-solid protection against unpredictable and potentially bankrupting medical costs.
And that leaves us with the final and most important question, and it's one that only you can answer. When you really think about your health, your savings, and how much risk you're comfortable with, is that total financial predictability worth paying a premium for month after month? Thanks for joining me on The Explainer.